fasciitis. Plantar fasciitis is a very painful condition in which you get a pain in your heel. It comes from that fascia getting inflamed. So it attaches down here at the heel and it comes up through and attaches to each of your toes. So that's the plantar fascia. When that fascia becomes inflamed, it causes pain. You'll get a very sharp pain in your heel and it's very, very painful in the morning. So some at-home things that you can do, of course you can take over-the-counter, Advil, some of those anti-inflammatories to reduce the pain and reduce the inflammation, in addition to some stretching and some strengthening exercises and even rolling out that fascia. So a lot of times plantar fasciitis happens because maybe we've changed our shoes or maybe we haven't changed our shoes. So pretty much every 3 to 6 months, you need to change your shoes. If not, you lose that arch support. And if you have a higher arch and that arch starts to fall, that's when you get the trouble with the plantar fascia. Or sometimes if you change into new shoes and you have more pressure on that arch, it can cause things to become inflamed. So a couple things you can do. So I have a little ball here and you can place that little ball down. I'm gonna turn to this side so you can kind of see here. You can roll that heel and all the way through that arch, that midfoot on that ball. I also have a foot roller that we can use, and you can just, again, roll that foot on there to reduce that pain. And make sure you put a little bit of pressure into it. You wanna kind of put some pressure and roll directly into that heel and all the way up to those toes for that fascia. Another thing that you can do is a calf stretch. So if you have a towel, you can place it around the toe and you can straighten out that leg and give a nice calf stretch here. This is the gastrocnemius muscle. That is the larger calf muscle. 3 reps, 30 to 60 second holds. Then you also need to stretch out that soleus. So a bent knee and you pull up on that foot. Again, 3 repetitions and 30 to 60 second hold. So that is a good stretch also for that fascia because you're pulling those toes back and stretching out into the bottom of the foot. So a few strengthening exercises that you can do. You can get a towel and you can place it on a nice smooth surface and you can use your toes to grip and pull up. This is a great strengthening exercise in addition to calf raises. So for that gastroc muscle, we keep those knees straight and we do calf raises, and then we do bent knee calf raises. So we lift those heels up with our knees bent so that we get into that soleus muscle. Unfortunately, with plantar fasciitis, it doesn't go away quickly, normally. You can get lucky, so if you start getting pain, you want to start treating it immediately. If you know that you changed your shoes, you might want to go back to your old shoes. The new shoes might not be proper for you. It might be too much of an arch support, so it puts too much pressure, or it might not be enough arch support. So that is very, very important when you're talking about plantar fasciitis. In addition, you can, if you have a lacrosse ball, or this one has just some little ridges on it to kind of dig in there, it's almost like a myofascial release. So you kind of work that fascia and you increase the circulation, so you bring the good blood flow to that area so that it can heal. You can also take a lacrosse ball though and place it in your freezer so that when you get it out, you're also icing, because icing that area is extremely important. And of course, that's going to be right on that heel and just traveling up. But that main pain is right down here where that attachment is. So hopefully you learned something today, and hopefully this helps correct your problem. Have a good day.